The United States is one of the largest countries in the world. We have more than 320 million people counting on a healthcare system that is failing. So how can we fix it?
Healthcare in general and healthcare providers can become better by not caring about the bottom line more than they care about the individual.
Instead of curing the disease, spending a lot more time on prevention.
I think the biggest thing is just listening to your patients. Actually listening to your patients and not trying to just write them a prescription and say, here you go.
I just feel like a lot of things in the medical industry are for money, specifically.
It's supposed to be about healthcare, yet money is so deeply involved in those things.
The biggest lacking issue is compassion. You know, just the simple compassion.
Treat it less as a business and more as a calling.
We know our country's struggling with what's the right model of care, how to solve for the challenges of healthcare in our country. Permanente Medicine provides an answer.
We've been here for 70 years doing the same thing in the right way, adhering to that mission, preserving our values.
I think the country's looking for a model like Kaiser Permanente.
We are the largest and most diverse medical group in the country.
Over 22,000 physicians.
All working together across the United States.
From where the sun rises in the east to where the sun sets in the west.
And our goal is to improve the healthcare and experience of over 12 million people.
With a large country made up of multiple communities that have unique cultures, how can a single care model work for everyone?
We have a bunch of influence from cultures around the world.
People here are very educated. It's a very international city.
You get the feeling of like the big new city. You can feel invisible, but you can also feel like it's like a huge family.
It's the birthplace of a lot of things. A lot of movements start here.
It's like a city of action. It's a city of like, we don't like the way this is happening, so we're gonna do something, whether they be on one side of an issue or another.
It's pretty open. People with their like sexualities and like all that stuff and gender and stuff is very like open.
In order to take care of the individual, you have to appreciate where they're coming from.
Everyone's different, and it's not one size fits all.
They come from very different backgrounds, socioeconomic class.
There are issues related to gender and generation and race, culture, ethnicity, sexual orientation.
The biggest way you can respect someone's culture and beliefs is just by listening.
Along with that is respecting the autonomy that they have for making their decisions and understand their perspectives.
That's the only way you're going to deliver effective health care. And you can't have trust without understanding people's culture.
With that trust, our patients are more willing to reveal symptoms or history that might be significant.
I love to practice medicine at Kaiser Permanente. We get to focus on care.
I spend time with my patients, follow the best evidence, the science, do what's right for the member.
I have an extraordinary group of colleagues. We're a collaborative team. They're brilliant doctors. I learn something from them every single day, and they're there for me.
I can pick up the phone and call a pulmonologist or my critical care doc. We could just say, hey, can I run something by you?
We have radiology, procedural care, primary care and specialty under the same roof. That makes it easy to practice good medicine.
I love the providers here, and they are so, I don't know, they care. You know they care about you. And I, as a patient, appreciate that.
My doctor, Dr. Richard Isaacs, I was at ease in meeting him right from day one. I really felt special, and it wasn't just Dr. Isaacs, it was the entire staff.
How does such a unique and successful system stay on top of dynamic changes in healthcare and medicine?
If as a provider I see something that I think can be done better, I have the support of the medical group to try to find a solution.
Whether it is to find the new cure, to define the next standard, that's what this organization's about.
Science and technology moves ahead so fast, and I feel that with Permanente Medicine, I am able to innovate and stay ahead of that.
In order to provide health and wellness for our members, it really starts with you.
If we don't start with ourselves, then how are we going to take care of our family and our friends and our patients? So let's all be concentrated on our own wellness and the wellness of others.
So how can a model like Permanente Medicine create a positive impact for everyone?
When people lose touch with that meaning in medicine, a noble, high-minded mission, that's where a lot of physician wellness goes out the window.
There's a lot of self-sacrifice and in fact, self-neglect on behalf of the patient.
To be the answer to health and healthcare in this country, we must be the answer to physician wellness.
The power of Permanente Medicine is it impacts both individuals, but also the community in which they live in.
When we touch an individual member and their family, and they improve, it really does spread out into their community.
Our commitment is to help improve healthcare for our country and actually from around the world.
We are knocking it out of the park on quality every single year, year after year in every region.
Through our model, lives are saved, functionality is improved, they can live happier, healthier lives.
You know, I can count so many physicians that have said to me, I came here because when I have an impact, it affects 12 million people. And when 12 million people are affected, then 330 million people are affected. I am here because I can change an entire system, and that means something.